precautions so we can be fit and healthy. With this, I would like to invite our guest and co-host, Dr. MS Kanwar, Senior Consultant Pulmonary Critical Care and COVID Team in Rupes Apollo Hospital. Welcome to the show, Dr. Kanwar. How are you, Dr. Kanwar?
I'm fine, Rashmi. How are you doing?
I'm fine, Dr. Kanwar. Thank you so much for asking, and thank you so much for coming forward to make Health Talk awareness show successful. It's all happening because of you. Thank you so much for being a strong pillar of my identity always and supporting people across the globe, I'll say. Thank you so much. So, Dr. Kanwar, what is the situation and how things are in India, and a little bit of limelight on what process is going on regarding the COVID?
Well, Rashmi, the problem still raging in India. It's still raging. And it's like I've been always been saying, it's been like a wildfire. It has to burn itself out. Whatever we are doing medically to help people, the patients, is to support them and treat them and pick them at the right time and let them prevent them from going into a very severe, serious situation at the hospital level. But at a community level, globally, the number of cases has been something like 27.7 million worldwide, with how much? 0.9 million deaths. It's terrible. It's no pandemic ever in the history of pandemics has ever been so devastating. In India also, the numbers have crossed 4.3 million. Uh, and the deaths have been something like 74,000. The numbers are still, in fact, the daily count has been something like 80,000, in the range of 80,000 new cases every day. But I was looking at today's number, it has been 55,000, but this could be an anomaly. The numbers are still very, very high. And let's see how it goes. In Delhi, the situation had come to a fairly good control, in the sense that people had started to breathe a sigh of relief. We, as healthcare frontline workers, also were feeling much relieved and happier, and so did, I'm sure, our administrators like Dr. Subramanian. But in the last week or two, the numbers have been rising and rising fast. In fact, today has been the highest record number in Delhi, crossing 40, how much? 4,000 new cases in just one day. So that is terrible. But the reasons are very clear in our mind. It's not that a new mutation has happened, or some the virus is is taking a different shape, different angle. No, no, no. The reasons are that we were under lockdowns. We were very careful about certain things, and a contact, and using mask and hand sanitization, which has of late gone for a six. And if you go look at the roads, the way people are traveling, the way there is a crowd, the traffic jams, that means people are going somewhere. They're moving. They're coming in contact. The metro has started now, is starting, in fact. So we anticipate the numbers are not coming down easily. So the numbers have been low because of the lockdown effects. Those places where there was no lockdown or a partial lockdown, or it was like a loose sort of lockdown, there the numbers rapidly went up. But the lockdowns did help us be prepared. The preparedness, Dr. Subramanian will tell us, how we got prepared in that time, saved people, which otherwise could have flooded the hospitals. And probably, we wouldn't have been able to cope with that situation. But that is still, we are fighting a battle. We are fighting a war, not a battle, actually.
Absolutely. And a little bit of limelight on your textbook. Our viewers will be a little bit curious to know about the COVID-19 textbook.
Uh, yeah, Rashmi, you touched a live chord, So I'm working very hard. Subra knows every bit of it. Um, it's been like working day and night. I'm not getting enough sleep, and that caused a little bit of health issue. And Subra was concerned. He said, "Oh, Manjeet, if something happens to you, what is going to happen to the book?" I said, "Okay, Subra, let me get better. I'll sort it out. Don't worry. So um, the book is going pretty well. In fact, there have been about 60. There are about 65 contributors to that, and I'm very proud of each one of them. Each one has worked so hard. There have been some delays, but the chapters are coming out absolutely stunning. I'm so proud of that. It's coming up better than I anticipated. So that is, at the end of the toil, we feel that we'll come up with something really worth it to be proud of. And Subra has contributed one chapter and a half. That half I'm still waiting, maybe in another day. But obviously, he remains so occupied. Rashmi, I would like to introduce our guest today.
Yes. Yeah, Dr. Kanwar, we can hear you.
Little noise. Just okay, fine. Dr. Subramanian is my colleague for the last 25 years, and we joined Apollo Hospital together. And he's a fantastic urologist, and he joined as a urologist, but lately, in about a year and a half, I think, he's been a director of medical services of Indraprastha Apollo Hospital. His background is that he worked and qualified in UK, in the Royal Colleges of Glasgow and Edinburgh, and he also had a diploma in urology from the University of London. And he's a Rotarian. He has been president. Let me look at that. He's been district governor of Rotary International. So he's been a lot into Rotarian activities, and he also serves as the chairman of the healthcare committee of the PhD Chamber of Commerce and Industries, and as co-chairman of healthcare committee of FICCI, and an advisor council member of the People to People Health Foundation. So Subra is a multifaceted personality, Rashmi, and besides being a nice human being, very caring, he's been a fantastic singer. You don't know about that, but he and his wife Lalita, fantastic lady. They are wonderful people when they are on the stage, and their duets. I think someday we'll have some program on that. But today we'll be talking to Subra, not as a singer, not even as a urologist, but we'll talk to him as an administrator in the toughest of the times that can make or break somebody. So that was the situation of COVID-19. In fact, it shook the entire world, not only the political world, but the healthcare world, and the health warriors, the administrators, the ministers. Everybody has been shaken up. In fact, people lost their jobs. People lost their credibility because of this one small little virus. And let's say what Subra has to say. Welcome on the show, Dr. Narasimhan Subramanian.
Thank you. Thank you, Rashmi, and thank you, Manjeet. I think, thank you for inviting me to a part of a wonderful event. It's been a great experience, and working during the COVID program and on COVID-related issues has been a great experience. Just to give you a little background, when you look at it, there is nothing in the world which has impacted over a third of the entire world's population. We do not know of a condition which has completely disrupted everything, from lives to livelihoods, to travel, to transportation. And there is no facet of life which has been impacted so severely. When we look at the context of India, the Indian population is the equivalent of the entire North America, the entire Europe, and plus Brazil and Argentina. So you can look at what problems you had to contend with. But let me look at the challenges of the COVID. When I look at it from the point of view of an administrator or one of the large hospitals from the largest corporate group of hospitals in the country today. We are a 72 strong hospital group. And our own hospital is one of the largest tertiary care hospitals, which means we deal with a lot of major life-threatening conditions requiring major transplants of the liver and kidneys, with major oncology services, major neurological and cardiac services. So what did COVID do to us? When you look at any disease, for instance, it requires good doctors, good hospitals, good equipment, good medicines. With COVID, it was just not that. It needed every individual of the society, every state, every nation, and globally one had to have programs to ensure that we kept people safe. So what happens in a hospital, for instance? To me, it is not just about treating the COVID. I have an amazing team of respiratory and critical care physicians, internists, anesthesiologists, and all support divisions with an excellent infection control team. But what's more important, I had to make sure that people who had non-COVID related conditions, be it emergency or non-emergency, I had to make sure.
So we'll come to that. We'll come to that. I have that in my mind. I will discuss that. But tell me, I mean, in the early days, when we used to have our boardroom meetings, Rashmi, I was telling you that we used to have 3 times a week boardroom COVID meetings. You can imagine the kind of pressure we all had on ourselves, and what kind of we were having directives from the ministry, the Delhi government. So I would want Dr. Subra to briefly tell us about, when the government asked us to have 50 beds for COVID, while other services would continue, then 100, then soon 100 beds, 200 beds, 300 beds. How he managed to cope with the situation. There were problems with suddenly generating COVID teams, doctors, nurses, paramedics, engineering, negative pressure ventilation, ICUs, food handlers, garbage, bio-waste. Lots of things were to be handled. Subra, how did you make those teams? How did you arrange for those teams, and how difficult was it for you?
Great. You see, I think, like you said very well, it was the coming together of people from every segment of healthcare. The governments, both the central and the state governments, came together. There was a huge partnership between the governments and the private healthcare. In India, as you know, the largest volume of tertiary care has been supported very ably by the private hospitals. Now, when we had to formulate a team, like I said, the primary focus was providing the care without disturbing the segregation between the COVID and the non-COVID. The disease was new. The learnings were new. So every day, every other day, every third day, there would be a new advisory, there would be a new director for the public, for the hospital. We, as a large hospital, we had an amazing infrastructure, and yet we had to look at building the teams in a way that not only we had to segregate teams who would separately provide care for the COVID and the non-COVID. We had to provide passages which would be separate for the COVID and the non-COVID. We had to create structures within structures where the complete air handling units had to be redone. We needed negative pressure areas. We had normal pressure passages. We needed positive pressure theaters. Everything had to be done. A lot of retrofitting had to be done. But what was most important, and to me, not only as a challenge, but perhaps as one of the most delightful things that happened to me, was the way people would come together. The way they stood together as one single team. The entire nursing division, the entire medical teams, the engineering, the facility management, the food and beverages, the housekeeping services, the administrators, medical records, IT. everything coming together, not only to treat patients, not only to protect the patients and the staff, but also to make sure that we had real-time information to help us make decisions. Real-time information which was shared with the government on real time so that they could make decisions. The ministers, the health secretary, would interact with the medical heads of all the institutions to make sure we had common policies, adherence to common advisories. We as a hospital, like you were saying, regular meetings was the only way that we had good exchange of ideas. We made sure everybody understood exactly what the plans were. There was no member at any level who did not have a direct access to the senior most member to make sure that it was an open door policy. So every problem identified at the ground level was immediately addressed. As you know, right in the beginning, we were uncertain about the value of the different tests. And yet, the tests were the basis of either quarantining people, isolating people, treating people, tracing and tracking people. Everything needed a protocol, a process, an SOP. I mean, I know people like Manjeet would have at one time been fed up with me. There was a time when there would be an SOP would be sent to every consultant, probably every few minutes or few hours. But we made sure that it was communication which made a huge difference, that we all adhered to the same systems, same policies, and did not for a moment hesitate to speak our mind. It's the protocols and the processes which helped us circumvent a lot of issues, surmount a lot of issues, and most importantly, to keep almost all our staff very safe in spite of treating COVID patients, those treating non-COVID patients. All of them remain completely safe while treating these patients. So I think it's coming together. To me, it's partnerships, protocols, processes, but most importantly, the camaraderie.
But Dr.
Yeah,
I have a question,
absolutely.
and our viewers really want to know one question, that there was a lockdown in India, but still the curve is higher now for COVID. So why is there lack of awareness, or what it is? So why people are not understanding that they are putting the doctor's life in danger? So what is your note on that?
See, I think, sorry.
Yeah.
Yeah, you see, I think what you mentioned about the value of the lockdown and the rising curve, both these, though they have occurred one after the other or sequentially, I would believe may not be as directly related as many of us might believe. The lockdown certainly had an impact in terms of perhaps minimizing the transmission. The lockdown probably reduced the number of people who might have contracted the disease. However, we do not have a mechanism to compare. If we had an option to compare a situation where we had a lockdown and where we did not have a lockdown, then the numbers might have spoken a different story. Similarly,
Yeah.
the value of testing. When we began, you see, whenever you look at this, brings a very basic question of economics. What happens when countries, as India, the way we are growing, the idea of creating self-dependence or Atmanirbharta we've been talking about is extremely important. But even a country like India, who are the world's third largest pharmaceutical industry, to some extent have been dependent on imports to certain countries. So when we had a new disease where the availability of testing material, testing equipment, testing kits had to be brought in the face of a complete shutdown in transportation and travel the world over. Perhaps the value of the numbers as we see in the beginning represents those who were tested. Again, were they tested at the same level across different countries? We do not know. Even when you look at a situation of such a large population like Delhi, for instance, we have the capital territory of Delhi, the wider Delhi as we call it, would have a population of almost approaching 40 million. Delhi as a city per se, the central city perhaps has about 19 million. This excludes a lot of daily travelers. There are migrants who travel into any city of opportunity. Many of them with nothing in their hands at all would perhaps, somebody whose survival depends on whether he gets a meal for the day, and a child who probably might get his or her glass of milk, I don't think he gives a damn about whether he's going to die of coronavirus. And for a man who's grown up with poor hygienic standards, which he took as a normal part of life, for a man with low education levels, sanitization or distancing just did not appear as a part of his life at all. So to me, for a person who grew up with 2 sisters and 3 brothers in a little tenement of a 10 by 10 room or something with his parents, to him, I think the concept of segregation or a concept of social distancing would be something he might find difficult to deal with. He might feel lonely. So I think it's a question of, apart from being aware of the value of the need to distance, it is also the background in which these people grew up, is what made it all the more difficult. But on that regard, I must say, when you look for the not-for-profit organizations, when you look at the media, when you look at the institutions, when you look at the schools and colleges, when you look at women's self-help groups, I think they have done an amazing amount of work to ensure that people at least become aware of the value of these.
Hopefully things should be fine soon. That's what we are looking forward. And Dr. Kanwar, we have a question for you. I have a viewer, she's asking, what should I do if I have had close contact with someone who has COVID-19?
Well, if it's a close contact, then you obviously have a high risk of developing the disease. So you should, first of all, we must know that the incubation period is a time when you get the contact or get the virus in your body and the time to develop the symptoms. It's about 6 days. Various studies have shown about anything from 4.5 to something like 6-7 days, but it can be up to 14 days. So between that period, there is a time when you could develop the symptoms. Before that, you may not be knowing whether you will develop the disease or not. And when you develop the symptoms, you could actually become infective to others 2.5 days before you even develop the symptoms. That is the problem. So you wouldn't know whether you are going to become diseased or not. And if you are going to become diseased, then even before you develop symptoms, you could actually be transmitting the virus to others. Now, that is how this disease has spread like a wildfire globally all over the world. So my advice to them is you be very careful about your symptoms. Try to use those strict measures of mask, the hand hygiene, and maintaining distance. And it is not the time to isolate yourself, but mentally be prepared that if you develop any symptoms, the first thing you will do, even before doing the test, sometimes the tests have taken time, sometimes the test reports have taken time, you should isolate yourself. The idea is so that you don't become a spreader. So that is what you should be doing. Just be careful about any onset of symptoms, that everybody knows what this disease causes, and the contact that you're talking about, from where you probably got the disease. Make sure if he's a family member, he or she should be in strict isolation. Strict isolation. Plus, of course, treatment depending on what the symptoms are. If the patient is more sick, you should go to the hospital. But as a prevention, I mean, you should be just watching the symptoms very, very closely. There are drugs. There are drugs which we try in India, but it is not in USA. In USA and North America, it is only used as emergency use authorization. So you cannot get those drugs, which we tend to give as sort of a preventive means in such cases. Rashmi, Janak, I'm having a lot of noise in my ears. So I'm having difficulty. Can you just sort it out, please? Yeah, it's better.
Yeah. You can continue, Dr.
Yeah. So I'm done. So this is what my advice is: to be very watchful, very careful, and segregate yourself, isolate yourself. The moment you develop of the symptom, and the slightest of the symptom would usually be either a little itching in the throat, a little bit of fatigue, tiredness, or low-grade fever. That is how it starts to develop in majority of cases. Some people would develop a loss of sensation here, what we call anosmia. The sense of smell goes, the taste changes, but a little bit of burning, as if the throat is constricted, a little bit of cough, irritation, and low-grade fever with malaise, weakness, tiredness, fatigue. These are the most common symptoms you should be watchful of. Some people would develop chest pains, a bit of diarrhea, and a little bit of nausea. But these are anything that is happening these days, we take it as something to do with COVID unless proved otherwise. This is the state of affair in India.
Very true.
So, what is the limelight on the vaccine, Dr. Subramanian? Our viewers are really curious to know what is the situation and how things will be back to normal. So, of course, it's a question from both of you. We really want to know, and people are really getting stressed right now because they really want to be out of this situation. It's pretty long actually, and it's more worrisome and stressful actually.
Can I there are two dimensions that I would like to address about the vaccine. One is that, the vaccine typically defines the lack of clarity between the hope and expectation. We are all hoping the vaccine is here. The expectation is a little different. But, we need to look at the vaccine in the context of the broader perspective of the disease. There are, when you look at in the last 100 years, few diseases which have been very well controlled by vaccines, which have taken a long time to arrive, number one. The vaccine is not going to be necessarily immediately be available for everybody, even if it were to come. In a country like ours, which is a 1.3 billion population, we need to be sure, number one, how effective it is. How long does it protect an individual? Logistically, how many people are you going to be in a position to deliver the vaccine to, over what period of time? And we need time to quantify the magnitude of the side effects. But at this time, if I were looking at it scientifically, I am more worried about another factor than the vaccine. And that is the number of people dying from other conditions. Manjeet mentioned about the several thousands who have died or who are dying of COVID. I don't know how many of you know this. In India, 7,000 people die from cardiac conditions every day. 300,000 a year. several million a year, I mean. You have 2,000 who die from cancers every year, every day. We are the diabetes capital of the world. We have people in large numbers who develop kidney failures. So if I did not treat my cancers at an early stage, if I did not treat my neurological and cardiac conditions early enough, if I denied people the radiation therapy, if I denied people the dialysis that they require, or if they were denied the chemotherapy that they require, many more would die while we treat people in the fear where about 4 to 5% at most might die. I'm not suggesting that this is a small number. Any death is bad because we care for people. Our business is people. Every human life saved is important. But we need to be cautious. In today's world, where the non-communicable diseases of blood pressure, diabetes, kidney failures, chest diseases, neurological conditions, strokes, kill far more people in a month than corona is going to kill in a year. So I think it's very important that while we maintain complete protection in terms of hand sanitization, good social distancing, good protocols and processes, I think life has to move on where we do not ignore the other medical conditions. Hospitals like ours, even during the COVID period, had to be prepared to take on emergency brain surgery, emergency vascular blockages, emergency deliveries, emergency cesareans, emergency orthopedic procedures. So, the entire world is looking at new protocols, new procedures. When we are doing laparoscopic surgeries, when you're looking at robotic surgeries today, newer protocols are coming in to make sure that the patients are safe, the staff are safe, the surgeon is safe. And one other factor that I would like to bring in here, which is going to be a great prevention, I call it the digital vaccine. This is the value of virtual consultation, telemedicine. The value of telemedicine today, I don't think anybody can overemphasize that. It is perhaps the most important single dimension where I, as a physician, will make sure that while I am protecting my patient and myself from exposure to each other, and also making sure I am not missing an early stage of a disease which needs an early intervention. The value of using the artificial intelligence today by analyzing data to predict, even with COVID, we should be in a position to predict who is at risk and who is not at risk, or who is at a lower risk and who is at a higher risk. I'm sure you must have read today, people are talking about letting the younger people interact more to perhaps go into the stage called the herd immunity. While you protect the elderly and those who might be either immunocompromised, those who might have other conditions which make them more at risk. But there is nothing, I think no vaccine, nothing else is going to protect you better than wearing a proper mask wherever you are, making sure your hand hygiene is perfect, making sure your social distancing is appropriate. Very often we believe that we wear a mask. When I meet Manjeet, I might be wearing a mask. But when we perhaps start talking to each other and having a cup of coffee, both the masks are off.
Yeah.
So that probably brings me a higher risk at that point in time than wondering what's going to happen to my vaccine.
And Subra, let me interrupt you here. Rashmi, in our board meeting today on COVID, one of our younger colleagues, she said, Dr. Subra, where is your mask? Where is your mask? And Subra looked at her. He said, well,
And you know where it was.
Okay,
You know,
Rashmi, just coming back to your question on vaccines. I know that Moderna has been into advanced phase 3, and I raised doubts in my earlier interviews with you that they'll be able to do enough before the U.S. general elections, because that was a major overriding issue, and Donald Trump was so keen that the vaccines be ready and be delivered before the elections that might turn his fortunes. And I told you that that's not going to happen. It's extremely unlikely. But if that thing happens, that means something has been going on, some kind of manipulation has happened, or they decided to lower the numbers of phase 3 trial recipients. Anyway, let's see what happens. In the meantime, the Russian vaccine, which has been launched, that is not undergone phase 3 trials. It's been a very small number of under 100 patients where the vaccine showed efficacy, but that is not the number in phase 3 trial. It should be some like 30,000, and they are closely monitored, carefully analyzed, and the data analysis takes several months amongst a lot of reviewers. So there are lots of things that Subra said earlier. The vaccine efficacy, the vaccine, what is the duration that the efficacy lasts, and very importantly, the side effect profile of the vaccine. So there are 3 Chinese companies who are in the advanced stage of production, and of course we know about the Oxford vaccine. That is probably going to be more comprehensive than any other vaccine. In India, there is a biotech company which is producing in collaboration with ICMR and NIV Pune, which is called Co-Vaccine. So there will be, Rashmi, there will be several vaccine companies. There will be several vaccines which will be available, but it will take some time. And it is not going to be a single vaccine which is going to cover the entire world. And then there's going to be mass production of those vaccines. And probably for mass production, India is going to be one of very significant centers, because India is leader in vaccine production and vaccine testing and vaccine mass production. So whosoever makes a vaccine, wherever in the world, for mass production, they would take the help from India. So that is the status about the vaccines. Coming back to Subra. Subra, there is a very important issue we've discussed today, and that is the COVID warriors burnout issue and the fatigue syndrome. Rashmi, I'm having a constant noise. Can Janak do something about that, please? Yeah.
Don't you have
Getting
a noise?
this- Okay. Oh, you're not hearing, but I'm having constant.
Yeah.
Okay. All right. My system is just my mobile phone. All right. So, Subra, back to you. This is a thorny question, but I'm sure you will take it head on. So, the fatigue syndrome that, people who've been into this, working day and night for 6 months or something like that, there are burnout issues. So I'm sure you're trying your hard to cheer them up, keep them in good spirits all the time. And have you been incentivizing them also, Subra? I know,
I
Subra.
think,
I know. Everything is not in your hands, but there are a lot of things which you're doing, and we appreciate that. And what is being actually done at your end?
okay. You see, like you said, the entire challenge having come on so quickly on such a global scale with limited understanding, limited preparation would have been a great challenge. But let me begin by telling you how brilliant, how generous every member, every healthcare worker has been during this entire episode. I know of young nurses whose parents did not want them to come into duty on the COVID ward. I know of young mothers who had young children to go back to at home. They just came in on two things: faith in themselves, faith in the leadership, faith in God. But when you continue to work with continued anxiety and apprehension, where you're covered from head to toe in your personal protective equipment, your visors and your glasses which tend to fog up, your gloved fingers and your hands not as nimble and dexterous as it normally would be, it certainly raises a fair amount.
And the heat factor.
And the heat factor. So, it's something where all the things that you and I dislike are put together as one single package, where you are confined day in and day out, plus the apprehension of the future. There is nothing that would, I can even compare or fathom in terms of what individuals are going through. But what we realize are what we can try and do. Number one, building up a sense of camaraderie. Number two, be constantly available. I often tell Manjeet that one of my job descriptions, I say, is a punch bag for many of my colleagues. Because when you need things done quickly, you need things done quickly. Third was the question of incentivizing. What were the incentives? The first thing was for every member of the staff to know that you were doing your best to protect him or her. You were testing regularly, rigidly, extensively. You were tracking even those at the most minor risks of potential contamination. You made sure that the staff was transported wherever necessary safely. You made sure that they were rotated in a way that there was rest in between these sessions. The financial incentives to some of them were the least valuable to many of them. It is a clear demonstration of human spirit here that I saw. The human spirit where they valued being valued. It was not a monetary value we are talking here. The support, the way each one supported the other, the way the leadership stood as one at the ground level, I think that's what achieved it. And Manjeet, you know how it worked in terms of collaboration. Over 50 internists, critical care physicians, anesthesiologists, neonatologists, surgeons, gynecologists, obstetricians, and supported strongly by a very, very strong administration and infection control, working as a single team. And Rashmi, you must find it very fascinating. We were 72 hospitals who worked on a single treatment protocol. Single treatment protocol, which has been revised 28 times since we admitted the first patient on the 23rd of March. The 12th edition is out, taking into consideration the global experiences, the learnings on the histopathology, the learnings on the pathophysiology and the progression of the disease. So it's coming together, notwithstanding whether it's Manjeet treating the patient or Subra treating the patient, the protocols were clear to all of us, based on experiences from so many countries who got there before us. So I think that, Manjeet, to me, is a telling point. Coming together again, strict adherence to protocols, and most importantly, the leadership. If you remember, the chairman himself and the senior leadership has made it a point to frequently motivate the staff members, make sure that every new information was shared with every division and disseminated to the last man at the ground level. The training and the development, the way they worked, the information on even the steps to don, to doff, to sanitize, the securities who protected the entrance and exit of the hospitals, made sure that everybody who might potentially be running a risk of having the disease or transmitting is identified early enough, isolated early enough, so that we did not. I can't say you would stop spreading of the disease, but you substantially minimize the possibility of it.
Rashmi, he just talked about the protocols. I'll just give you a very small little example. Today, when we finished our boardroom meeting, the time was 1:30, 1:40. We started at 12:30, Subra. And when we all rose up, I just raised my hand and said, guys, please adhere to the protocols, because there was a little bit of miss here or there, but then there are so many hundreds of patients and dozens of consultants. So, and everybody has his own mind. So there is a tendency to deviate from the protocol. So I had to just raise my hand. I said, guys, just make sure the protocols are adhered to. Another thing, how frequently we change the protocols, the treatment protocols, because the information is written through so frequently from all over the world, and our own experiences, what we were learning, day to day, week to week. The last protocol we decided on was about 6 weeks ago. I wrote the chapter on management of COVID. What is the best management strategy? By the time the chapter went for printing, I thought I need to modify the protocol. The protocol has not been modified yet in those 72 hospitals across India, looking after 9,000 patients. But I thought I will change. I tweaked a few things because I thought this is what is most appropriate. And before it goes to final print, I made those modifications, which we will do in our probably one of the next meetings on the protocol. So that is how things, we have been on the cutting edge all the time. In fact, we did not miss an opportunity to discuss the subject, especially the treatment and other things, where we thought it could affect the outcome of the patient care. So that is how it is. Rashmi, you have any questions, more questions?
We have covered everything, and it was great information from both of you. And of course, again, I'll say a big salute to all our doctors and nurses. They are our lifesavers. Thank you so much. And Dr. Subramanian, it was really great having you on our show today. Thank you so much for taking our time. And Dr. Kanwar, it's great being part of show with you always. Thank you so much.
No, I think it's an absolute delight. Thank you for having me on the show. I think it's been tremendous. Every time you share your thoughts, it gives more clarity to the individual. So I feel, at the end of this chat that we've had, I feel more refreshed with many of my own facts in my mind. But, just as a point on the vaccine while we are talking about, I'm sure all of your viewers also would be very happy that Nigeria has recently been declared free of polio as well. As a Rotarian, I'm a great believer in vaccine preventable diseases. And as a die-hard Rotarian working on the polio vaccines, I believe humanity coming together has almost wiped polio from the face of the earth. And I'm pretty sure the combination of vaccines with lifestyles would eventually help us to overcome COVID in a substantial manner. And just to add an optimism here, as a single institution, single hospital out of a group, out of over 1,700 patients who have been admitted in my hospital during the past few months, with COVID positive diseases. Over 1,500 have gone home well and happy. But we need to be aware, knowing the disease pattern, some of these people might have secondary issues arising out of the disease. So we need a very strong and structured COVID rehabilitation program, which is what we have created. So we not only plan to treat people who have this problem, we also plan to follow up these patients to make sure that if at all any of them had any residual complications, we will be in a position to handle them adequately. So going forward,
we have this. We need these clinics because there is a growing concern and issue of what we call long COVID, COVID-related complications, which have hung on with patients for months and months together. So that is a major issue with a lot of post-COVID patients globally. In Europe, in USA, they have set up clinics, and in India, they have been clinics set up already. So that is how it is going to be, and we probably would see a gradual decline, but it's not going to go away very quickly. But we are certainly going to see gradual decline. And just to add to the optimism, we always feel that eventually you will be a corona kind of not just survivor. You would have kicked corona out of your system. You would have become immune to corona after a few months. So just wait for that, and just you have hung on that long. So just hang on for a little while longer, and you would be fine. And as Subra said, we in our hospital, among those 1,700 patients who were admitted with COVID disease, we have had one of the lowest mortalities anywhere in the country. So we have done exceedingly well considering the kind of patients we were receiving, very sick and serious patients. Rashmi, if you don't have any more questions, it is time to wind up. But yeah, Subra, yes.
I think, though every segment of the healthcare team has worked very hard in these things, but I think I just want to take this opportunity to especially thank our guardian angels. I think the young nurses, I think the way they have gone on and on and on. I think, any public platform to express my gratitude to our nursing fraternity and every other healthcare workers. Our housekeeping have been such outstanding contributors to preventing spread of infection. The chaps who have kept every surface clear, every door handle, every glass surface clear. I think each individual, this is one situation where physicians have worked very hard with a lot of focus, but keeping people safe has been the responsibility of so many people who were not physicians, but who had a big contribution to make in planning and keeping people safe. So stay safe, and I can't thank you enough for including me in this program. Thank you so much.
And finally, Subra and Rashmi, in COVID times, a lot of people have lost jobs, but this was also an opportunity for a lot of them, some of them, not a lot of them, some of them, to become heroes, because they had to outsmart the virus. They had to be very sharp, hardworking, brainy. And Subra, you are one of the heroes. Cheers to you.
Thank you.
Thank you.
So, thank you for coming to the show.
Thank you so much.
Thank you.
And Rashmi, thank you so much. You're always wonderful. And Subra, the guy behind the camera who arranges everything, is Janak Bedi. So he talks very little, but he is the man who controls everything. Thank you so much, Rashmi and Janak, and thank you, Subra.
Thank you.
Thank you. Thank you.